So first of all, for our regular update, we had another case diagnosed yesterday, so we now have a total of 252 cases. We encouragingly now have 209 that have now completely recovered, and what is really exciting for us, we now have only 29 active cases. So that's really important for us as we move forward. Our death rate remains at 13, and so we've had no further deaths, which is also encouraging for us. Our attribution of cases, contact tracing accounts for most of our cases identified now through contact tracing. Our travel-associated cases have virtually declined to nil now, and the numbers of cases in the care homes are also declining. So we're seeing a decline across all of the sectors. So that's really, really encouraging. I thought what I'd do today is also discuss the R value, or reproductive rate. Reproduction rate, R0, it's got lots of different terminology. It's being used a lot in the UK, and I'm sure it's no surprise to all of you. We've calculated what ours was, because you know how much we like evidence in public health. And I think from our perspective, the main thing is to think what the R rate does. So the R rate is a measure of transmissibility of the virus. So if you have an R10, one person can then potentially affect 10 other people if there are no mitigations in place. So we have done broader testing across the piece, and we've also tested, for example, all of our care home workers. So we've picked up quite a lot of asymptomatic cases. But despite all of our broader testing, our R value is less than 1. It's 0.85. Now, what we plan to do, because it's small numbers, and we're always really concerned about wide confidence intervals with small numbers, we've thought about how we can make this number meaningful. So what we're now going to do is look at a rolling 28-day R value. So we're going to roll this forward and then just look at our trends with time. So we'll publish that probably on a weekly basis, because daily there's too much variation. So that's what we're planning to do with our R values. I think relying on an R value for our exit strategy would be too risky for us, and I think we'll take note of our R value, but we want to link it with other evidence. So with the exit strategy, we've got what we call our adaptive triggers. So our adaptive triggers are both our release triggers, which take us to the next phase, but they're also our reversion figures, which would take us back. And we've thought about it very carefully, and we will take note of the R value, but we're also using, for example, markers like community seeding. Now, community seeding is obviously really important for us. We're backtracking that onto what's going on in our hospital. Do we have an early intensive care activity? So we're looking at a number of parameters, and the timing, we're looking at the incubation period of the virus and looking at how we calculate that, put in a measure of safety. So we're looking at a number of triggers both to move forward and to move back, and that will be published as part of our plan. Now, what we say about these triggers is they may vary. If new evidence comes in place, then we will have a look at it, and we will, of course, modify what we do, because this is a dynamic situation. So I think that's really important from our point of view with regard to the reproductive rate, together with the triggers of going backwards and forwards. What I also wanted to acknowledge today is the enormous work that has been done by my colleagues in public health. We are really they've worked together as a fantastic team, 7 days a week. If there's a job to be done, it doesn't matter how early or how late it is, it's simply a job to be done. And I couldn't ask to work with a better team. So I've been incredibly privileged, and I'm incredibly grateful for their hard work. Because although I sit in front of you a couple of times a week, 2-3 times a week, actually what I'm representing is a very hard work that's done by the entire team. And I don't think we must ever underestimate how important that has been to this effort. And what I'd finally like to do is Emmy and Harley contacted me, and Emmy and Harley sent a wonderful picture. Now, Emmy and Harley are children of key workers, so they're in fact at school, and they sent the most wonderful picture of Deputy St. Pierre. Unfortunately, Deputy St. Pierre is wearing a bow tie there, and I think they'll be a bit annoyed with him because they wanted him to wear a bow tie. But anyway, you promised to next time, didn't you? And Emmy and Harley sent us this wonderful picture that they did of the garden that they'd made whilst they're at school. And it's really so grateful. I'm so grateful to see this. And they've done some wonderful things. They've done the Guernsey together. They've done our rainbow. They've planted some plants. And they've worked really hard on that. So I wanted to say thank you very much to Emmy and Harley. You really made my day when I got this. It was such a lovely thing to receive. So thank you.